injuries. First, the brain. The brain is a large soft mass of nerve tissue that is contained inside a vault of bone called the cranium. That one. And the human brain has more than 10 billion nerve cells and over 50 billion other cells and weighs on an average of 3 and 1/8 pounds. The brain receives sensory input from the spinal cord as well as from its own nerves. The brain and the spinal cord consist of the white matter and the gray matter. The white matter bundles of axons, each coated with myelin sheath. The myelin sheath is a very thin, it's a sheath that covers the group of axons, the nerves, like a wire. The gray matter, masses of cells, bodies, and dendrites, each covered with a synapses. The other structures are the cerebrospinal fluid, CSF, and the, how do you pronounce it? Meninges. Yeah. The cerebrospinal fluid, or CSF, a clear bodily fluid that acts as a cushion or buffer of the cortex, providing a basic mechanical and immunological protection to the brain inside the skull. So that's why the brain is floating, and no matter what you do, intact. The meninges is the collective term of the fibrous membrane that envelopes the brain and spinal cord, providing protection to the delicate tissue of the central nervous system, or the CNS. Pathophysiology, or that means the changes of functions after the injury. Research suggests that not all brain damage occurs at the moment of impact. The damage to the brain from the traumatic injury takes two forms: the primary injury and the secondary injury. The primary injury is the initial damage to the brain that results from the traumatic event. This includes lacerations, the turn of blood vessels due to impact, acceleration, deceleration, and the foreign object penetration. The best example is the car accident. Secondary injury evolves over the ensuing hours and days after the initial injury and is due primarily to unchecked cerebral edema. Ischemia, and chemical changes associated with the direct trauma to the brain. An injured brain is different from other injured body areas because of its unique characteristics. It resides within the skull, which is rigid, closed compartment. Unlike the injured ankle, in which the covering skin expands and swelling, the confines of the skull do not allow the expansion of cranial contents. Any bleeding or swelling in skull increase the volume of contents within a container of fixed size and therefore can cause increased intracranial pressure, ICP. If the ICP is high enough, it can cause displacement of the brain through or against the rigid structure of the skull. This causes restriction of the blood flow to the brain, decreasing oxygen. Other term is anoxic, inadequate delivery and waste removal. Cells within the brain become anoxic, which means, inadequate and cannot metabolize properly, producing ischemia, infarction, irreversible brain damage, and eventually brain death. The common conditions, we have the scalp injury and the skull fractures. Scalp injury, isolated scalp trauma, is generally classified as a minor injury because of many blood vessels constrict poorly and scalp bleeds profusely when injured. The trauma may result in abrasion or brush wound here, contusion, laceration, or hematoma beneath the layers of tissue of the skull. A large avulsion of tearing, or let's say the forceful tearing, away from the scalp may be potentially life-threatening and is a true emergency. The diagnosis of a scalp injury is based on the physical examination. The inspection, palpation, the scalp wounds are potentially portals of entry of organisms that cause intracranial infections. Therefore, the area is irrigated before the laceration is sutured, remove foreign material, and reduce the risk of infection. Skull fractures. is a break of the continuity of the skull caused by the forceful trauma. It may occur with or without damage to the brain. Skull fractures can be classified as simple, comminuted, depressed, or basilar. The simple or linear fracture is a break of the continuity of the bone. Comminuted skull fracture refers to splintered or multiple fracture lines. The depressed fracture, when bone fragments are embedded into brain tissue. The basilar, which is the base, is a fracture at the base of the skull. Now this is the spinal cord. The spinal cord is has been grouped. The vertebrae can be organized into sections and are named and numbered from top to bottom according to their rotation along the backbone. Let's say, if the doctor says, "Oh, you have a tear in the D5. Oh, where's D5? This is D5. So, oh, the tear is here. The tear." Now you get to it. So it's D5. So they refer to the thoracic from here. Yeah, the yellow one. Thoracic up to there. Cervical vertebrae, the neck. Lumbar here is the the sacral vertebrae, which is the tailbone. Okay, next. Now, the assessment and diagnostic findings. We have here radiological examination confirms the skull fracture, computed tomography or CT scan, the magnetic resonance imaging, the MRI, the cerebral angiography identifies the supraancisorial and the extracerebral and intracerebral hematomas and the cerebral contusions. When assessing a brain injury, be alert to the signs and symptoms. The altered level of consciousness, confusion, the pupillary abnormalities, the changes in shape, size, response to light. The pupillary is very little black where the light passes in your eye. Oh no, inside the iris. Altered or absent of gag reflex. The absence of corneal reflex, again, that's the eye. Changes in vital signs, maybe the sudden increase of blood pressure and suddenly drop, so that's very important. The sensory and vision impairment. Oh, okay. Headache, seizure, and the sensory dysfunction. Okay, next. The manifestation. Persistent or localized pain. Oh, I have a headache here. Again tomorrow. Oh, again, it's the same. And then next, may or may not produce swelling, especially fractures of cranial vault. Hemorrhage from nose and ears. And blood may appear under the conjunctiva here. Area of, oh, what's this again? Help me. Ecchymosis, or bruising under mastoid, or also known as battle sign. Battle sign means the indication of fracture of the base of the posterior portion of the skull. This is the posterior. Where am I? Cerebral spinal fluid from ears, or also we call the otorrhea, and the cerebral spinal fluid from the nose, which is the rhinorrhea. Now, the guidelines. Number 1, monitor level of consciousness again. Number 2, maintaining the airway. Number 3, monitor vital signs, the SPI, blood pressure, and the rest. Pulse and the company. Monitor fluid and electrolyte balance, input and output. Yeah. And assess motor function. Intake and input, I'm sorry. You're doing great.
That's good. You're doing good.
The spinal cord. Ah, there he is. The spinal cord is the largest nerve in the body. Think of it as a thick telephone cable, one that connects the brain and other parts of your body. Both your brain and your spinal cord make up the central nervous system, the CNS. Together, they stand together. They make sure that what you see or feel, what you think, and what you do are properly processed and relayed. They also control things you're barely aware of. The bodily functions which act as the automatic pilot will keeping you alive from keep you alive. Breathing, heart rate, the blood pressure, the bladder and bowel movement or elimination. The structure and location and functions of the spinal cord. The spinal cord is the senior vice president. The liaison between the nerve passageways in the body and the brain. The brain itself is the CEO. And these are the employees. Now, where am I? Translating the information and delegating actions. Regulating activity, keeping things organized and easily retrieved. The motor nerves work on the big picture, the movement, the breathing, and the body's regulation. The sensory nerves provide the way we view and react. They send messages to the brain, which interprets what we see, feel, taste, and touch. The facts and figures about spinal cord injury. There are estimated 10,000 to 12,000 spinal cord injuries every year in the United States. 250,000 Americans are currently living with spinal cord injuries. The cost of managing the care of spinal cord injury patients approaches $4 billion each year. 38.5% of the spinal cord injuries happen during car accidents, almost of a quarter. 24.5% are the result of injuries relating to violent encounters, often involving guns and knives. The rest are due to sporting accidents, falls, and the work-related accidents. 55% of spinal cord injury victims are between 16 to 30 years old. More than 80% of spinal cord injury patients are men. Now, how come it's 16 to 30? That's very young. And mostly men. Yeah, kids driving.
High school football. Yeah, athletics.
And then, why mostly men? Because
they're crazy.
Because they're careless. Yeah, aside from that,
and they can show off.
They're
more
testosterone.
I was in a car with a guy and I was getting mad. His seatbelt in the back door, he was fine. He's doing like 70, like down the Washington Hill. But I got so mad, I like wanted to get out of the car with him. He's not gonna show up. Not attractive at all.
Right.
Yeah.
and then like 16 years, like gang, the high school, like gang law, the fight, and then mostly in the construction, and then sports, skiing, motorcycle. Now, common disorders and diseases or conditions of spinal cord injury. Breathing. Breathing, any injury of the spinal cord or above the C3 or C4 and C5 segments which supply the phrenic nerves leading to the diaphragm can stop breathing. People with these injuries need immediate ventilatory support. When injuries are at the C5 level and below, diaphragm function is preserved and breathing tends to be rapid and shallow and have trouble coughing and clearing secretions from their lungs because of the weak thoracic muscle. Once pulmonary function improves, a large percentage of those with C4 injuries can be weaned from mechanical ventilation in the weeks following the injury. Second is pneumonia. Respiratory complications, primarily as a result of pneumonia, are a leading cause of death in people with spinal cord injury. In fact, the intubation increases the risk of developing ventilator-associated pneumonia or the VAP by 1 to 3% per day of intubation. More than a quarter of deaths are caused by spinal cord injury are the result of VAP. The spinal cord injury patients who are intubated have to be carefully monitored for VAP and treated with antibiotics if symptoms appear. Oh, I'm sorry about it. Irregular heartbeat and low blood pressure. Spinal cord injuries of the cervical region are often accompanied by blood pressure instability and arrhythmias. I cannot read the rest. Then third.
I like that.
Blood clots. People with spinal cord injuries are at triple the usual risk for blood clots. The risk for clots is low in the first 72 hours, but afterwards anticoagulation drug therapy can be used as a preventive measure. Pressure sores. Pressure sores are areas of skin tissues that have broken down because of continuous pressure on the skin. People with paraplegia and quadriplegia are susceptible to pressure sores because they can't move easily on their own. Spasm, muscle spasm, or spinal cover. It's alright. Next is autonomic dysreflexia. Autonomic dysreflexia is a life-threatening reflex action that primarily affects those with injuries to the neck or upper back. It happens when there is an irritation, pain, or stimulus in the nervous system below the level of injury. The irritated area tries to send a signal to the brain, but since the signal isn't able to get through, a reflex action occurs when without the brain's regulation. Unlike spasms that affect muscles, autonomic dysreflexia affects vascular and organ systems controlled by the sympathetic nervous system. Again, pain, bladder elimination, reproductive. Oh, this is interesting. The spinal cord has a greater impact on sexual and reproductive function in men than it does in women. Most spinal cord injured women remain fertile and can conceive and bear children. Even those with severe injury may well retain orgasmic function, although many lose some of, if not all of their ability to reach satisfaction. Now, the common medical terminology I use in this report are MRI, CT scan, ICP, and the PET scan. MRI, magnetic resonance imaging, CT scan, computed tomography, ICP, increased intracranial pressure, PET scan is positron emission tomography. Oh. Almost there. The guidelines. Client needs are an example. Client needs.
PowerPoint.
Yeah, the client needs like self-care skills, including ADL, examples feeding, and physical care, support of heart and lung function, mobility skills, ambulation, respiratory care, ventilatory care needed, breathing treatments and exercise to promote lung function. Communication skills, speech, socialization skills, interacting, vocational training, work-related skills, pain and muscle spasticity, medication, psychological counseling, identifying problems. Oh, I have here assistive devices. Now, we have the leg braces for the spinal cord injured client or patient. I have here the walker. You can use the cane. Only one. You have to use two. And then next is the wheelchair. Oh, rotor rest bed, spinal injured, and for cervical collar. Now this is very making the patient more comfortable because they can go Facebook. They can go online.
They can go online.
Yeah, they can go online. Oh, but they can.
Yeah. I don't think you can go online.
Don't work. The Facebook.
No, they use the voice activated.
And then the cervical collar. Use it not to avoid
Moving.
moving.
Yeah.
How was that again?
No more.
Yeah.
Oh, so use the